I'm Lauren. I'm one of the neuroinflammatory fellows on the team. I have the pleasure of introducing you to Joley, who you all have probably already met. Joley is the wonderful nurse practitioner in our clinic. She's been with us for 10 years. 10 years. 10 in February. Yeah. Yeah. For those of you who haven't met Joley, you will meet Joley. For those of you who have met Joley, you just know how a wonderful asset to our team she is. She's really the face that you can contact, and she's always advocating for her patients and working hard for her patients. What you don't see behind the scenes is what we're talking about with all this access and how hard it is to get medications. We talk to you guys about the medications. We give you guys the medications, but what you don't see is Joley's hours of paperwork that she has to apply to the governments and the companies and every single person who she's begging to give you guys these medications. So we're just really lucky to have her. Today she'll be talking to you guys about transition and what you can expect as you go into the adult care system.
Thank you so much, Lauren. I'm sorry for the AV person. We kind of messed up the order because we originally were going to have some patient stories, which we are going to do, but I'm going to chat first and then we're going to do that. Does anyone need to stretch their legs for a second? Everyone okay? Okay, thank you for that nice intro. I know everyone in here. I recall talking to people about plasmapheresis, putting in lines. I said, trust me, trust us. People were like, this is crazy, like I'm scared. And I say, trust us, right? And thank you for trusting us. Thank you for trusting us. Thank you for being here and for supporting us. Oops, I told you I'm AV challenged, so hopefully I didn't like bugger that. Oh, at this one, okay. Okay, so this is meant to be a bit interactive. So if people want to ask questions, like please do, it's not, super formal. So we're going to talk a bit about health transition. So in the pediatric world, we have to transition our patients out in SickKids that's 18 years old. So when we're talking about health transition, to define it, we're saying it's a purposeful planned movement, okay? So it's sort of a continuum. We want to start having these dialogues with our complex patients who are on these acute therapies. We need to start thinking about this when patients are 16 and starting those discussions. And so it's sort of a continuum, and then sometimes it goes forward and sometimes it goes back. Sometimes we have patients move out and then have to come, back to us. And so it's not, just a one-stop kind of thing. When we talk about transfer, oh gosh, did I just mess that up? So a transfer of care represents a one-time thing. So a patient in Sudbury presents with acute encephalitis. They are then transferred to SickKids, a handover is given, and it's a transfer of care, and that hospital is no longer involved. That is not what transition is. We're talking about something that's a process, and hopefully a positive one. So all of our patients, or most of our patients, should I say, who are in the GTA will be transitioned to St. Michael's Hospital. So their clinic is called the Barlow MS Clinic. And so sometimes people say, why has my child been transitioned to an MS clinic? They don't have MS. So that is the name of the clinic. It is the right place. The same neurologists like Dr. Ye and the other two wonderful neurologists here take care of MS patients and patients with autoimmune encephalitis, MOG, NMO. So even though it's called the MS clinic, don't fear, your child is going to the right place, okay? They're gonna be seeing one of the wonderful, they have a very large team there of amazing neurologists. If your child is living outside the GTA, so some of our patients go to school in different provinces, they decide to move, then we'll find them a community neurologist. There isn't always big neuroinflammatory programs, so sometimes we're forced to refer them to a general neurologist, but we will always find someone who can take care of your child, whether they're in Ontario or out of province. So why is the successful transition important? So negative transition care experiences can not only impact the child, but also impact the parents, and it can also impact them going forward, right? If your child does not have a good transition to the adult team, and that is, they don't have a good relationship and they don't develop a therapeutic relationship and a rapport with that team, there's a risk that they're not going to continue going to care. And so obviously those first few appointments, you may be going with your child to those appointments, but as they get older and older, you may not be able to accompany them to those patient appointments, and it's up to them to go on these appointments on their own. So the transition needs to be successful, just so develop that new relationship so that hopefully that they're not lost in that transition process. There's not a gap in care or a gap in services. So we really want to make sure that things go smoothly so that happens. A lot of our youth who have medical complexity, or if they have developmental disabilities, they need their parents to come to the appointments. They need their parents to advocate or other caregivers. And like I said, there can be a gap in services if we don't identify those needs and support our kids. And so we obviously want to support our children and adolescents moving through the system. So the core principles of transition planning, there's a few of them. And so I'm going to kind of go from left to right. So starting early. So I talked about this as like starting at age 16, right? Even though we have to move by age 18, we want to start the dialogue, start talking about it, start planning our adolescents to be autonomous and talk about their own health concerns, talk about their own medications. The teen should know what they're taking, know their health history, have access to MyChart. In SickKids, we have an electronic chart system that patients, anyone over 12 years old, can get access to MyChart. They can then have their parents have access, so parents can also view MyChart. But it's important that the child creates the account and has that ownership of their own health. And so that can even start at 14 or 15 in some adolescents, but we definitely want to start that process at least by around 16. So creating an individual plan. So obviously this is going to be dependent on where is the child going to be going to school, where are they going to be living, or who are they going to be living with. So starting early and creating an individualized plan. Some of our patients not only need to see neurology, but they also may need to see rheumatology, or they need to see an epilepsy specialist. So making sure that we're talking about what is it going to look like? What is that circle of care going to look like? Who are those providers going to be? So we want to provide support before the transition. Again, talking to patients about it, talking to parents about it. If there is anxiety, parents always say, oh my gosh, we don't want to leave SickKids. We're so comfortable here. So we are going to help you through this. It's not like, as soon as your child's 18, we're like, we can't talk to you anymore. We're going to keep talking to you. We're going to help you through this. But we want to provide support before the transition and starting to having, if there is concerns or anxiety, that we deal with that, right? And sometimes we have our adolescent medicine people help us if there is significant concerns or barriers. We have people who can help. So communicating between the pediatricians and the adult providers. So this is where, when we're sending the referral, or if we have a particularly complex case, we'll often reach out ahead of time and give the providers the heads up, or have some context given, because our patients are really complex in some situations. And so we start that communication. We start it early. Things around drug coverage, like we alluded to, some of the drugs that our patients are on, like rituximab, which is paid for by SickKids, is not paid for in the adult system. And so starting to talk about that, how are we going to get access? If this child is on rituximab, how is that going to continue that they can still get access to this medicine once they leave SickKids? And then we want to provide support after transition. So all of our patients, once they've been transitioned to St. Mike's, we book another follow-up appointment to say, come back and see us. And some parents say, hey, we're good, we don't need this, but we say, let's just do a virtual check-in, if nothing else, just to make sure that everything was successful, that a therapeutic relationship was developed, that they had the care notes and all of the communication, and that there's no concern. So that follow-up appointment that people say, well, we already transitioned, what do you need to see us for, is really important, just to sort of close that loop and to make sure. And obviously, like I said, if for some reason, later on there's a challenge, you can come back to us and we'll help you with that, right? If there's a challenge within the system or with the provider, we will try to help you navigate that. Or if there's a change where someone's moving out of province, we will help you, okay? Any questions so far? So there's some resources we're going to talk about. There's limited evidence to support like which interventions are helpful, right? There's things where they've done group things, like I'm giving you education about transition. There's different apps, there's websites, there's a few different things I'm going to talk about. Some of the commonly used things are these education, like we're providing today. Like I said, in some cases they have these navigators or coordinators that help. We used to have a program called Good to Go, which was actually a program that we could refer patients to at SickKids who had complex needs that would help with finding a health team for them, and that was actually a really great resource. So for SickKids resources, we have About Kids Health. Has anybody ever gone on health.ca? Yeah, okay. So I've got some great stuff. I'm trying to get information about all of our conditions on there, but they do have a resource and this learning hub with some transition resources. And so if you go to About Kids Health, you can find some of these resources. So one of the things, and this is something you can start with your teens now. So this is the whole learning about your own health, and this is this 3-sentence summary. So what that is the first sentence is giving your age, your diagnosis, and a brief health history. The second one is their treatment plan, and then the third might be a question that they could raise at the visit. So in this example, hi, my name's Jamie, I'm 15 years old, I have MOGAD, and I'm taking rituximab, and I want to know if I can try it for track and field. So even that, just that little thing, instead of like, the provider comes in and the parent is talking, right? We're going to try to empower the child to have autonomy, to have this, even if they don't know a lot of information, but they just know, what their diagnosis is, what their medicine is, and if they have something that they want to learn at the appointment. So this is a great little start that you can start even at 14 and 15. So there is a great app that was actually developed by our rheumatology colleagues at McMaster Children's Hospital. So this is a free app called My Transition, and it's available through Apple. And on this, it's got a transition Q scale, which is a validated scale that they didn't develop, but that is available on the app. And this is a great scale that you can do each time, and you can sort of assess where are the needs. And so it's a 14-item thing that asks about certain questions. And so if there is a deficit somewhere, we can say, oh, hey, I don't know about my health history or things like that, and then we can address it. So this is a good little questionnaire to do. Also in the app, they have a calendar that can assist with keeping track of appointments. There's tips and little transition readiness stuff. And then, like I said, that transition Q scale, which you can do multiple times, not just the one time. This is another resource called Got Transition. And they also talk about some of the elements. They've got some resources on this website too. And this is my chart. So I just wanted to show you that both CHEO, for anyone has been to CHEO, no. I was like, I think someone says, so CHEO and SickKids have this my chart. And so we encourage all of our patients to get this. Again, any teen over 12 years old has to create the account themselves. And then they give proxy access to parents. So one thing I'm just going to briefly talk about is accessibility. So this is a big thing, right? Not only transitioning healthcare, our teens are transitioning into different education or into their vocation or their employment. Many teens are going to post-secondary education. So talking again about accessibility services. So all of the Ontario universities and colleges have accessibility services. So each college has its own program. You often have to just self-refer, so the teen can basically, if they decide, okay, I'm going to Western University, they would contact the Accessibility Center. They usually book an appointment. They get to know the adolescent. There's a questionnaire and some other things that are filled out. And this is helpful because if your kids have IEPs or they're getting accommodations for extra time with exams or they need special accommodations, what would be the IEP in high school, this will get carried over through the accessibility program to make sure that the teens have those services. And we've had some teens who've been able to go to separate private rooms. They're allowed to wear noise canceling headphones. Lots of different accommodations. If they have mobility issues, they've been allowed to, take elevators in school or have special access. So really important if your child does need any accessibility services that these are contacted. The other thing too is if you have an IEP in high school or your child has had a cognitive or a psychoeducational assessment, that can also be given to the university to help inform the accessibility plan. And there's often paperwork that the health providers have to fill out. So you guys just forward it to me and we'll fill it out just to make sure that our teens are supported. And so again, all of this is all happening at the same time. Their health transition, they're moving to school, maybe moving to residence. So it's a lot, but we can start some of these things early. As soon as your child gets acceptance, we can start doing the accessibility stuff again before they're 18, so it's not all happening at the same time. There is also a bursary, so if patients are going to qualify for OSAP, there is a bursary for patients who have disabilities. And so this is a bursary that gets paid so they don't actually have to pay back. What will happen is there's, again, an application for OSAP. Usually there's a meeting with the financial aid office. There has to be some type of health questionnaire, which I often fill out, to get a bursary. And this is this BSW application. So again, if your child does have a disability, they may qualify for this. So just as a quick overview again. So our checklist is discussing transition early, knowing your own health information. So this is getting your MyChart access, knowing about your disease, knowing about your medicines, begin managing your own healthcare. So this would be encouraging your child to learn this 3-sentence summary. And then discussion and referral to the adult provider. So that often happens around 16 and a half or 17. And then transferring to the adult provider, having that first appointment, again, coming prepared with your own questions. What is the system like? What is the program like? Who are my contacts? You want to know all of that after that first appointment. And they will spend an hour. So they always book a 1-hour appointment, a new appointment for any of our patients who are transitioned. And they should provide you with all that information at St. Mike's. But coming in with your own questions is a good idea too. And then again, completing the transition is returning back to us for that final appointment, giving feedback about your experience. And if there's any questions or concerns, that would be the time to bring it up to us. Okay, so that's it.